Hi, and thank you for joining me. My name is Dr. Nicole Chase, and I'm an allergist located in Minnesota. I would like to talk with you today about one of my patients with severe asthma and why I chose to prescribe TEZSPIRE, tezepelumab-ekko. TEZSPIRE is approved as an add-on maintenance treatment for adult and pediatric patients aged 12 years and older with severe asthma. TEZSPIRE is not indicated for the relief of acute bronchospasm or status asthmaticus. In two pivotal studies enrolling a broad all-comer patient population, meaning no baseline biomarker level requirements, TEZSPIRE reduced asthma exacerbations by up to 71% in the Pathway study and 56% in the Navigator study compared to placebo. In addition, TEZSPIRE is the only biologic to demonstrate a statistically significant reduction in exacerbations in patients with blood eosinophils less than 300 cells per microliter. Reductions in exacerbations, regardless of phenotypic profile or biomarker level, were observed in patients taking TEZSPIRE. In a post-hoc pooled analysis of Pathway and Navigator, fewer exacerbations were observed in patients receiving TEZSPIRE versus placebo, regardless of baseline blood eosinophil count, fractional exhaled nitric oxide level, or allergic status. Results of this analysis are descriptive only. TEZSPIRE provided a rapid and sustained improvement in lung function. Treatment with TEZSPIRE improved FEV1 by 230 milliliters over baseline at 52 weeks. Moreover, 70% of the lung function improvement was achieved at 2 weeks. Please note that TEZSPIRE is not a rescue medication. TEZSPIRE is contraindicated in patients with a known hypersensitivity to tezepelumab-ekko or its excipients. Reactions, for example, rash, allergic conjunctivitis, can occur after administration of TEZSPIRE. These generally occur within hours of administration, but can have a delayed onset. Consider the benefits and risks. Do not abruptly discontinue corticosteroids. Dose reductions, if appropriate, should be gradual and may be associated with withdrawal symptoms and/or unmask previously controlled conditions. Treat patients with pre-existing Helminth infections before starting TEZSPIRE. If patients become infected while receiving TEZSPIRE and do not respond to anti-Helminth treatment, discontinue TEZSPIRE until infection resolves. Avoid use of live attenuated vaccines. After learning about TEZSPIRE, I thought about patients in my practice who could potentially benefit from this medication. I would like to share with you the story of a delightful woman we'll call Althea. Althea is in her mid-60s, and she recently retired from a career in healthcare. She was hospitalized once as a child for an exacerbation, but she hasn't had a hospitalization for asthma since. She experienced 2 to 4 exacerbations per year requiring oral steroids, despite being adherent to high-dose ICS-LABA and additional add-on medications. The first thing I noticed when I met Althea was the constant wheezing and her need for albuterol. Her percent predicted FEV1 was generally between 60 and 70%. When I first evaluated Althea 8 years ago, she had a clear history of allergic asthma. She was sensitized to perennial aeroallergens, and her symptoms worsened when she was exposed to cat dander and cigarette smoke, which were common triggers in her home. She also had a history of other allergic comorbidities, including allergic rhinitis and nasal polyps. Her total serum IgE level varied between 300 and 600 international units per milliliter. Over the last 2 years, Althea's asthma became more difficult to control, and her phenotype changed. Her total serum IgE was lower, approximately 150 international units per milliliter, and her blood eosinophil count was routinely less than 300 cells per microliter. When Althea initially presented to me, she presented with allergic asthma, and over the 8 years I've been caring for her, she's shifted to a non-type 2 phenotype. Fluctuating biomarkers and changing sensitivities to environmental allergens have made it difficult to control Althea's asthma and has led to frequent changes in her treatment plan. This has been her experience. Other patients may present differently. My goal is to improve Althea's asthma control, reduce her risk of exacerbations, and improve her lung function and quality of life so that she may be able to focus on her retirement and get back to enjoying a greater range of indoor and outdoor activities with her grandkids. What struck me about the TEZSPIRE clinical data that was observed was the impact on exacerbations across biomarker levels and in patients with or without allergic sensitization. Based on the variability of Althea's asthma phenotype and biomarker levels, I recommended to Althea that we add TEZSPIRE. I also like that TEZSPIRE targets TSLP at the top of the inflammatory cascade and can impact multiple pathways that can contribute to severe asthma. The mechanism of action in asthma is not fully understood. We reviewed various treatment options available and our treatment goals. Together, we made the decision to add TEZSPIRE. I explained that her individual results may differ from what was observed in the clinical trials. Althea and I discussed the safety information that I stated previously, the potential risks and benefits, and the most common adverse events associated with TEZSPIRE in the clinical trials, which included pharyngitis, joint pain, and back pain. I encouraged Althea to read the patient information available at tezspire.com. Althea and I reviewed the dosing and administration for TEZSPIRE. We discussed that she would come to the office every 4 weeks to receive TEZSPIRE by subcutaneous injection. I recently started Althea on TEZSPIRE, and I'll be seeing her in the office for a follow-up appointment soon. I can't wait to see how she's doing. Althea enjoys coming into the office, and our office staff looks forward to her smiles and the wonderful stories she shares. Thank you for listening to my TEZSPIRE moment. I've just shared how I made the clinical decision to prescribe TEZSPIRE, the first and only biologic approved for severe asthma without phenotypic or biomarker limitations. I invite you to review the full prescribing information for TEZSPIRE, including patient information, at tezspirehcp.com.